So osteoarthritis, it is a degenerative disorder. It is characterized by cartilage degradation, subcortical damage, and bone remodeling. And it is one of the most common disease affecting the weight-bearing joints such as the knee and the hip. Approximately 85% of the population is burdened by osteoarthritis worldwide, and it is one of the fourth leading cause of years lived with disability globally. One of the key options for management of osteoarthritis includes the NSAIDs, which represent a key strategy in the management of osteoarthritis, which is a non-pharmacologic treatment. And NSAIDs have dominated the treatment of osteoarthritis since the past century, with 50% of NSAID prescriptions being written for osteoarthritis. And expected benefits of NSAIDs include reducing stiffness and inflammation and improving mobility. One of the NSAID, what I'm going to focus upon is Etodolac. And Etodolac studies have shown that this is the study where Etodolac was compared with diclofenac, and it showed very fewer incidents of adverse events, and very fewer percentage of patients they required antacids as compared to the diclofenac arm. So it was as effective as diclofenac, but it was superior to diclofenac in terms of safety, such as the GI symptoms. This was another study where it was compared with naproxen, and the study concluded that Etodolac is not associated with statistically increased risk of myocardial infarction as compared with naproxen. However, naproxen had a higher incidence of GI bleeding and perforations. So the two major events of NSAIDs, such as GI side effects as well as the cardiotoxicity, are minimized with Etodolac, and therefore it should be preferred for patients who have got increased risk of NSAID related GI and cardiovascular complications. So I'm sharing with you the data on Etodolac initially. So this was an analysis which compared 10 double-blind placebo-controlled groups to see the effect of Etodolac on renal function. So this was an analysis of around 1,382 patients, and 228 patients were in the age group of 65 years and older. So the analysis said that no patient was withdrawn from the treatment due to an abnormal renal function because of Etodolac administration. There were no incidences in the definite renal function abnormalities in patients who received Etodolac. And long-term treatment with Etodolac in patients with arthritis does not appear to produce clinically significant changes in the renal function. Okay. Now, why I'm talking about this? This is because there is a concept which is called as chirality. So just to give an example of chirality, our two hands, they are identical to each other. Both have 5 fingers. And if I place my right hand on the left hand, which is shown in the screen, you can see they are not exactly fitting on each other because the thumb is coming in the middle. So these objects in our day-to-day life, these are what are called as the chiral objects. Okay. Or I'll give another example. This is a pair of bottles, and if you place the left bottle on the right bottle, they exactly fit on each other. So these kinds of objects are what are called as the achiral objects. Okay, so the concept of chirality was introduced by 1848 by the well-known microbiologist Dr. Louis Pasteur, and he discovered the phenomenon of molecular chirality based on his study of tartarate crystals. So chirality is a fundamentally important chemical phenomenon with essential implications in biology. The word chirality comes from the word chir, that is hand, and it has got vital implications in biology and medicine. So chirality can affect the pharmacokinetics and pharmacodynamics of the drug, and therefore it is essential to study the chiral aspects of these compounds. Okay, so how chirality is related to drug action. So this can be exemplified by a simple example that our left leg will not go into the right shoe and our right leg will not go into the left shoe. So it has to exactly match. So how is chirality related to drug action? Just a simple example. So this is a drug Okay, and it has got say two enantiomers. One is the S enantiomer and one is the R enantiomer. These are examples. So if you see the S enantiomer, it perfectly fits into the binding sites of the receptor. So this is the tight binding which happens when a chirally bound drug interacts with the receptor in a three-dimensional format. While if you see, this is another R enantiomer, and if you see the binding which happens is very weak, because you can see this group which is shown in circle is not fitting in this trapezium. So that is a weak binding of these drugs. Therefore, it will give a weak binding. Okay. So when we isolate single enantiomers, what will be the benefits? So it will lead to lesser complications, because racemate is a compound which is made up of two enantiomers, and we separate out the active one. There will be lesser complications. It will have a selective pharmacokinetic profile. It will reduce the probability of drug interactions, because you keep only the one active one. It will prevent the drug interactions. It will have a better kinetic profile, because we are giving a single one. And another important action is that as we are giving only the single isomer, it will give a half dosage, and therefore it will give a lot of benefits. So coming back to Etodolac. Etodolac is a racemate made up of two compounds in one. That is, one is the S-Etodolac and one is the R-Etodolac. So studies have shown that the S-Etodolac shows almost all the pharmacological activity, while R-Etodolac shows little. Okay, so in Etodolac, the S-Etodolac is the active NSAID, while the R-Etodolac is not an NSAID, because it is not blocking the prostaglandins. So studies have shown that S-Etodolac has greater concentrations in the synovial fluid as compared to the R-Etodolac, which is twice as high as the R-Etodolac component. And if you compare the two in terms of the pharmacological action, S-Etodolac has been shown to have 2 to 2.6 times greater potency in racemic etodolac in reducing the inflammation. R-Etodolac is inactive. It is twice as potent as racemate in terms of inhibition of prostaglandin release. And the second advantage is that etodolac is rapidly cleared from the plasma, while R-Etodolac requires more time for clearance. So overall, if you see, it is an active isomer, and R-Etodolac has no therapeutic significance. And we have already seen it has got twice the concentration in the synovial fluid as compared to the R-Etodolac. Okay, so study has been done on Etodolac, which is a multicentric randomized comparative study. So this was a study in Indian patients. Around 101 patients were compared. So one arm received the S-Etodolac 300 milligrams, while the other arm received Etodolac extended release 600 milligrams. So in terms of the WOMAC pain score reduction, there is a 65% reduction in pain score, around 71% reduction in stiffness, and 60% improvement in physical function. So the efficacy was documented. And in this study also, there were less amount of adverse events with the S-Etodolac component as compared with the Etodolac component. Also, in 2019, there was a consensus statement of all the different specialties. This was an executive summary which was published in JAPI. And of the orthopedic segment, they said that S-Etodolac demonstrated 2.6 times higher potency and bioequivalence at half the dose when compared to the racemic mixture. So key highlights of S-Etodolac, that it is an active component of Etodolac. It has been shown to have the potency which is higher than that of racemate. It has got a higher concentrations in the synovial fluid. It gives the effect at half the dosage as compared to the racemate. As there is a half the dosage, it leads to lesser metabolic load. And study and efficacy, safety and efficacy has been evaluated in treatment of osteoarthritis. So this was a short and presentation of S-Etodolac. I like to thank all the organizers for today's event. Thank you very much.